in half kneeling position with either yoga blocks or something to support you. If you can get all the way to the floor with maintaining a nice long spine, that's fine too, but I want you to be aware of what's happening here and try to create movement only from the hamstrings and back tissue of the legs. I'm a little bit sore today, but coming into this position, you can play with the foot. So there is nerve tension that can be created through the sciatic nerve up the back of the leg. Okay, you can do some nerve flossing, which can help relieve some of that tension. And then you can also go from side to side, which can help kind of stretch the different muscles on the inside and outsides of that hamstring. There's 3 different muscles of the hamstring, plus adductors. So that can help kind of relieve some tension there. So you can do like 20 to 30 of these, and you should find that the longer you're here and the more you floss these nerves, that they will actually give you a little more space to work with. Nerves don't like to be stretched or constant tensioned, so just pulling the toe back and creating what you feel behind the knee is actually not a good idea. So once you've done that, then you can do that for 1 to 2 minutes and use that as your stretch. And then you're going to work into creating contractions on the progressive and regressive side of the joint. So from here, we're going to slowly start to drive the foot down into the floor. This is an isometric contraction. Think 1 pound at a time, 2, 3, 4, etc., until you ramp up to 30 to 90, 100% of your max capacity, depending on your experience level and goal with this exercise. So the more you do it, the higher you can ramp up, the more comfortable with it. You're going to slowly, once you ramp up, you're going to hold 10 to 15 seconds. Breathe, try and keep the pressure consistent. Then you're going to slowly relax the leg. You're going to pull the kneecaps up, tighten everything on the front part of that leg, and you're going to try and lift that leg up off the floor as you pull and yourself deeper into it by extending the low back and pelvis. If you come from here and pull your nose to your knee, then you are using spinal flexion versus hip flexion to get deeper into this stretch, okay? So I want you to make sure that you are moving from the pelvis, extending through the low back, and flexing through just the hip versus allowing you to come forward, losing this spinal position, okay, and making it look like you got deeper into it. So flex that quad, pull yourself in. You're gonna hold 10 seconds, trying to pull that foot up off the floor, adjusting the hips to get yourself deeper into the stretch. 10 seconds, 9, 8, 7, 6, 5, 4, 3, 2, 1. Slowly relax, and then repeat. Okay, so just to recap the entire thing, I'm gonna switch feet, you don't switch feet, you can follow along if you want, I guess, but I just wanna make both sides somewhat even. So find your positioning, you're gonna hold 60 to 120 seconds, mild to moderate stretch, whatever feels comfortable for you. You can do some nerve flossing while you're here in this stretch, helping to relieve some of that nerve tension. And then relax the foot. Make sure you're not pulling that back up towards you as you try and go deeper into your stretch. From here, you're going to slowly start to drive the floor away from you. You're pressing into that heel, engaging all of the back muscles of this leg, slowly ramping up to your desired max capacity. Hold 10 to 15 seconds. 9, 8, 7, 6, 5, 3, 2, 1. Okay, after that, you're going to slowly relax the leg and then try and engage all of this front, all of the hip flexors. Try and pull yourself deeper into it by adjusting from the pelvis and extending the spine from the low back. 10 seconds here. 9, 8, 7, 6, 5, 4, 3, 2, 1. Slowly relax, take a breath, and repeat. Okay? You can also go into liftoffs from here. So if you are comfortable with liftoffs, you want to further your control in these ranges, you can come just barely out of your complete end range. So right now, I'm at complete end range, and in order to lift this up, I would have to come out of it a little bit. So you're going to back up out of it just a little bit. a breath. You're going to lift off out of your almost end range. So this is about it. I do have a stretch, but I'm not completely at the bottom of it. Take a breath in, brace through the core, don't let anything else move. Lift that foot up off the floor, hold, 5, 4, 3, 2, 1. Slowly relax, put it back down. Take a breath, rest for as long as you held, rinse, repeat. Take a breath, engage everything at the top, lift away from the floor, hold, 5, 4, 3, 2, 1. Slowly relax, take a breath, reset, etc. So you can repeat that on both legs.